Hello everyone. So today I'm going to start my this meeting, and here I'm going to share my face also. And today's topic is related to my topic is related to Ministry of Environment we done, and Ministry of Environment we done, and now we have the one more Ministry of Finance, Ministry of Corporate Affairs, and Ministry of Consumers. This all be done yesterday, and now we have ministry which is based on here, and this is about Minority Affairs, Ministry of Mine, Law and Justice, and one more Ministry of Skill Development. We are starting with Ministry of Home Affairs, Ministry of Heavy Industry. We didn't get this yet. We are going to start with Ministry of Health. Okay, so here I'm going to start with Ministry of Health and Family Welfare. Okay, so this is about the reduction of child and maternal mortality. First point is child mortality. Child mortality is very big problem, and maternal mortality, that is also one more problem. Okay, so we want to reduce it. Okay, second point is program implementation program, that is National Rural Health Mission. So National Rural Health Mission and National Urban Health Mission. Okay, so these two missions with additional fund, with what we want to do actually, or IMR, infant mortality rate, MMR, maternal mortality rate, should be reduced. We want this should be reduced, and the proper immunization, we need to do the proper immunization with health system strengthening. There is one more program, that is RMNCH plus A. Okay, this program is for the maternal, neonatal, child and adolescent health, communicable and non-communicable disease. Okay, so universal access to the public service, we need to increase the public service and access, this should be universally access. Okay, so what is our program right now? So our program is national level and state level as well as. Okay, so national level, there is the mission, Union Ministry of Health and Ministry of Health and family welfare, and for the state level there is a chief minister of all states, and intersectoral for the district plan, and village health sanitation committees, Anganwadi worker, Asha and community worker, they are working at the village level. Okay, so they all are working at the village level. Now National Rural Health Mission, next topic is regarding National Rural Health Mission. So we are going to start with National Rural Mission on the health. We need affordable, accountable and accessible system. Accredited social worker Asha, they are working here, and Janani Suraksha Yojana, Janani Suraksha Yojana, National Mobile Medical Unit. So mobile units are also there. Janani Shishu Suraksha Rashtriya Bal Swasthya Scheme, and RMNCH plus a reproductive maternal newborn adolescent health free drugs. We are providing the free drugs, and district hospital knowledge center mainstreaming with the Ayush. So this is all connected with the Ayush, revitalization the health. Okay, so this is all right. Now next one is, this is for the rural health, and now we are going to discuss about the national urban health. National urban health. So this urban health is for the state plus district, both are included. Need based approach and partnership with the community and local bodies and NGO, and Asian Development Bank. Asian Development Bank. It is helping to the National Urban Mission for the health. And there is a urban community health community process, and Mahila Arogya Samitis Asha also linked with this. Okay. Next is Rajasthan Kishore Swasthya Karyakram. Swasthya Karyakram. So this is a screen in school, that health facility and early detection of the disease. Thematic areas are nutrition, sexual reproductive health, misuse and non-communicable disease, mental health, injuries, and there is a Sathya resources kit. So Sathya kit is also provided, that is for the resources for a village discuss the sensitive issues, and Ministry of Health and Family Welfare, that is working for this, and UN fund is also there, UN population fund, that is also related to this one. And there is the Rashtriya Kishore Swasthya Karyakram. It is primarily in the rural area for the sanitary napkin. It provides a subsidized sanitary napkin also. So sanitary napkins, and that is in the subsidized rate. And with that, 15 million girls age of the 10 to 19 with the 152 districts and 20 of the states will meet here. Okay. Now next one is Rashtriya Bal Swasthya Karyakram. Next one is next scheme is Rashtriya Bal Swasthya Karyakaram. Okay, so this is about the child health screening, early intervention services. Surgeries are also available. Surgeries plus early identification and early intervention. What are the defects? What are the birth deficiencies and disease up to the 18 year of the age? Okay. So this is the Rashtriya Bal Swasthya Karyakram up to the 18 year, and 0 to 6 year is aim. This is the aim of this service, Bal Swasthya. And there is a child health screening early intervention service, free of cost services for the surgery and tertiary level, and 30 selected health condition for screening, detection and free management is also allowed. Next is Janani Suraksha Yojana. Janani Suraksha means reducing the maternal mortality rate, infant mortality rate. Okay. And for the pregnant and newborn, it is for the pregnant and newborn, it is for the pregnant and newborn, and this is entitled with the National Rural Health Mission with the cash assistance also provided, like cash assistant 500 per delivery regardless the age of pregnant woman and number of children also. So focus was the poor and pregnant women in all the states, and with a special dispensation for the low performing states. Okay, so there is a poor and pregnant woman who will provided the 500 rupees and performance based incentive as a asha. So Asha is working with this, and a small cash assistance also given to the home deliveries. Okay, now next scheme is Janani Shishu Suraksha scheme. So next scheme is about the Janani Shishu Suraksha scheme. Janani Shishu Suraksha scheme. So this is about the Shishu Suraksha, and it is also for the pregnant women and their health facilities, and their health facilities and zero expense delivery. So delivery will be zero expense. So no delivery charges will be provided in this scheme, and 7 day for C-section in public institution, like 3 day for the normal delivery and 7 day for the C-section. Entitlement based approach will be there, and it supplement the cash assistant for the pregnant woman in the Janani Suraksha Yojana. No component for the cash assistant within itself, but there is a pregnant woman under the Janani Suraksha Yojana is provided the cash assistant, but Janani Shishu Suraksha Yojana, it has no component for the cash assistant. Okay, so it is a Shishu Suraksha scheme, not the Janani Suraksha scheme. Okay, so pregnant women and the sick neonatals जो होते हैं, they will provide the zero expenses deliveries. Okay, now next scheme is प्रधानमंत्री सुरक्षित मातृत्व scheme, PM सुरक्षित मातृत्व scheme. Okay, so it is for the second and third child जो होंगे, all pregnant women who are in the second and third trimester of pregnancy. तो प्रधानमंत्री सुरक्षित मातृत्व अभियान जो है, दैट इज़ फॉर द सेकेंड टाइमर एंड द थर्ड टाइमर, and reduce the maternal infant mortality and safe pregnancy, safe delivery, provide fixed day assurance, quality antenatal care. It is providing the quality care for the antenatal children, antenatal, and free of cost also. So universally to all pregnant women, free of cost. One of the critical component is identification of the risk. Private sector doctors would support the initiative, and the scheme is available to the rural plus urban, both of the area. Pradhan Mantri Surakshit Matritva scheme. Next is Lakshya scheme. So next is the Lakshya scheme, and this Lakshya scheme is for the labor room quality improvement. So labor room quality improvement means it is a newborn mortality. We want to reduce the mortality, morbidity, and stillbirth associated. So labor room and the maternity ensure the respectful maternity care. That's why the Lakshya scheme is for the labor room quality improvement initiative, and plan to conduct the quality certification for the labor rooms also. Okay, so this is about the Lakshya scheme. Now next scheme is Surakshit Matritva Ashvasan, Suman scheme. So Suman scheme is for the Surakshit Matritva Ashvasan. Okay, Suman scheme. So now next scheme is Surakshit Matritva. Next scheme is Surakshit Matritva Ashvasan, and this is Suman initiative. Okay, Surakshit Matritva. So pregnant women up to the 6 month after delivery, and all sick newborns. Okay, and pregnant women up to the 6 month. Okay, so this is at least antenatal checkups होंगे, then during the first trimester, then iron and folic acid supplements will be provided, tetanus, diphtheria injections will be provided. Component of comprehensive package will also be provided, and this is also zero expense assess and zero expense assess. So in this scheme, this will be zero expense assess, free transport and home to the health institution also. So there is a free transport services and home to health institution will also be there. So zero preventable maternal and newborn death, zero tolerance about the services against the newborn, and assuring dignified respectful quality healthcare for the without any cost also. Okay, so this is the Suman scheme, Surakshit Matritva Ashvasan initiative. Surakshit Matritva Ashvasan initiative. Now next scheme is Mother Absolute Affection, Ma scheme. Mother Absolute Affection. So this scheme is for the national wide program of the breastfeeding. It is for the breastfeeding and counseling. Okay, so there is the ASHA worker and support the breastfeeding for the public health facility and monitoring and award also. Next is umbrella scheme for family welfare and other health intervention. So umbrella scheme for the family welfare. So this is Swasthya Nagrik Abhiyan. So Swasthya Nagrik Abhiyan, Population Research Centers is also there. So this is umbrella scheme for family welfare. So to improve the modern contraceptive prevalences, help the family planning, enable better child mother health, and that is the umbrella scheme for family welfare. And there is a Swasthya Nagrik Abhiyan, which is for the Swachh Bharat Abhiyan, and Yatri Suraksha and safety at the workplace is also included in that. Now population research centers under the Ministry of Health and Family Welfare, there is a population centers, population research and center, and this center will provide the old data regarding the population to the Ministry of Health and Family Welfare, and valuable data for the policy program at the district level, and social marketing, contraceptive, branding, attractive packaging and everything. Okay, now next is Mission Parivar Vikas. Next scheme is Mission Parivar Vikas. So next scheme is Mission Parivar Vikas. Okay, so this mission is to accelerate access for high quality. It is for the high quality family planning and right based framework. So the fertility goal, what is the fertility goal? It is 2.1 by the 2025. So this is our fertility goal, 2.1% by the 2025. So improving the contraceptive, so the delivering assured services containing product of family planning, and distribute a kit like Nai Pehal. This Nai Pehal is for the family planning and hygiene amongst the newlywed couple, and it will increase the sterilization services, roll out injections, contraceptive sub-center, generate awareness about the condom and pills and all that. So this is about the total fertility rates are there is a 146 high fertility districts, and Mission Parivar Vikas is all about that. Now next is Universal Immunization Scheme. Universal Immunization Scheme. So next scheme is based on Universal immunization scheme. Okay, so this scheme is about the free of cost vaccine. Vaccines will be provided free of cost, 100% funded by the central government. So this is a central sector scheme. First of all, there is a 12 vaccines which is available in this scheme, and measles, rubella, single vaccine, dual protection, fever from childhood, tuberculosis, hepatitis B, meningitis, pneumonia, and Haemophilus influenza type B, rotavirus vaccine, and diarrhea, and two disease Japanese encephalitis and the pneumococcal and pneumonia vaccine is also available there. So there is total 12 vaccine, and I describe here all kind of disease. So we need a self-sufficiency in the vaccine production with robust surveillance system and vaccine preventable disease, and we need the utilized vaccine and technology in UIP. So we need a utilized vaccine, new and under, like introduce and expand the use of new and underutilized vaccines and technology in the UIP. Okay, so now mission Indradhanush. Next one is mission Indradhanush. Mission Indradhanush. Okay, so this mission is for the ensure full immunization, for the full immunization, and for the focus on the pocket of low immunization coverage and hard to reach the areas for unvaccinated areas. So pregnant women who have left uncovered under the routine immunization, they will covered, and WHO and UNICEF, Rotary International, they all are working for this. Catch up campaign is also there. So catch up campaign for the immunization. With this intensified mission Indradhanush 2.0 program, it is intensified मिशन इंद्रधनुष, एंड लो इम्यूनाइजेशन को कवर करना है, एंड देन 272 डिस्ट्रिक्ट में इंटेंसिफाइड मिशन इंद्रधनुष was launched in the 272 districts and 27 states also. It focus on urban under-reserved population and the tribal populations, and also 12 best practices from all around the world is included in this feature. Okay, we need a full available vaccine for children up to the 2 year and pregnant women. सो अप टू द 2 years के लिए हमें क्या चाहिए, फुल ऑफ द वैक्सीन्स एंड टैबलेट्स एंड हेल्थ रिलेटेड ऑल immunizations and full health and vaccine with the children up to the 2 year, and this covers the pregnant women and this neonatal also. Now EVIN is the electronic vaccine intelligence network. So next is EVIN. EVIN is a electronic vaccine intelligence network. Electronic vaccine intelligence network. This aims to the government of India for universal immunization. It is for the universal immunization. Indigenously developed है ये. It is a indigenously developed. So it is a indigenously developed, and it is real. It provides the real time information, and it will reduce the inequality in the vaccine coverage. Okay. Now next one is National Deworming Initiative. National Deworming Initiative. What is deworming? Deworming means to reduce the prevalence of soil transmitted helminthes. So it is helminths. This is transferred because of the soil. So this is to which kind of parasite are incentivized worms, so they are no longer a public health problem. Now preschool and the school age children between the 1 to the 19 year of the age are providing this scheme. So Ministry of Drinking Water and Sanitation with the Ministry of Women, Child Development and Ministry of Human Resource with the Department of School Education, they are combined are going to launch this scheme, National Deworming Initiative. So which is Ministry of the Human Resource, Drinking Water and the Women and Child Development. Okay, so for the deworming, Ministry of the Drinking Water, Ministry of the Human Resources and Ministry of Child and Women Development. Okay. Now the National Center for Disease Control is the nodal agency. It will continue to take the behavioral change. Single fixed day approach will also be there. And age group is 1 to 19 year. Okay. So helminthes of the soil created which will be removed from this. Now next is Ayushman Bharat Pradhan Mantri Jan Arogya Scheme. Okay, so next scheme is Ayushman Bharat Pradhan Mantri Jan Arogya Scheme. So it is Ayushman Bharat PM Jan Arogya Scheme. Okay, so this is about the 5 lakh rupees will be covered up, 5 lakh rupees per household, and National Health Authority, it will set up under the National Health Authority. Okay, and this is for the JAM is also JAM means cashless Aadhaar enabled, cashless Aadhaar enabled, and JAM with centrally sponsored scheme. It is a centrally sponsored scheme, Jan Arogya. Pradhan Mantri Jan Arogya Yojana, that is centrally sponsored scheme, and cashless and Aadhaar enabled better services, portable across the country, and Pradhan Mantri Arogya Mitra is also connected with this. So PM Arogya Mitras are also connected with the Ayushman Bharat component Health and Wellness Center. Health and Wellness Centers. National Health Protection Scheme, that is Pradhan Mantri Jan Arogya Yojana, PM Jan Arogya Scheme, and National Health Authority, and portability will also be there. So this is around the 33 states and UT are implementing this scheme. Okay, next is Rashtriya Arogya Nidhi. So what is about the Rashtriya Arogya Nidhi? Next is Rashtriya Arogya Nidhi. So this is for the included government servants, not included government servants and families of the government service, but this is for the financial assistance to the patients. So this registered is under the Society Registration Act, Society Registration Act 1860, and it will provide the one time grant will be provided in this, and government hospital only, not the private hospital. Okay, only the government hospitals will provide this kind of the assistance. And there is a four windows like revolving fund, direct financial assistance, illness assistance, and health minister cancer patient fund also provided in the Rashtriya Arogya Nidhi. Next is integrated disease surveillance program. Integrated disease surveillance program. So this is the set up the central disease surveillance unit, central disease surveillance, central disease surveillance and early warning system, early and warning system with the rapid response team. Communicable and non-communicable disease are also covered. Integrated health information platform is also covered, and this is a IT enabled surveillance system, and name is integrated disease surveillance system. Okay, next is the intensified diarrhea. Next is the intensified diarrhea control fortnight. Okay, so diarrhea control fortnight. So now next one is intensified diarrhea control fortnight. Okay, so diarrhea is a very big problem. So we need the health personnel and state government and other stakeholder and government and international organizations who can reduce and who can create mass awareness about the ORS plus zinc therapy and demonstration with the conducted at state, district and village level, and there is the improve the availability of the ORS and zinc household facility level, strengthening manage dehydration, enhance the advocacy and communication on the preventable and control the diarrhea. Okay, under the 5-year children are suffering from the diarrhea. So this diarrhea is a very vast problem for the children. National Viral Hepatitis Control Program. National Viral Hepatitis Control Program. So this is national program management for the hepatitis, reduce the mortality and the morbidity to the viral hepatitis. Free drugs and diagnostics is also provided for the hepatitis B and C, and establish the 665 testing centers and 100 treatment sites are also there. Okay, for the 3-year focus on the hepatitis C. So viral hepatitis will focus on the treatment of hepatitis C over the 3 years. It aims to treat the 3 lakh hepatitis C over the period of 3 years. Okay. Now next is IT initiative in the health. So what kind of IT initiative can be generated in the health? You do you have any idea about this? So IT initiative about the health. So first is update the ANM to update the data beneficiaries. Okay, table based application will be there in the ANM, and this is ANM online application. Name is Anmol. So this is the ANM based online application. Okay, next is the Kilkari. So Kilkari means free weekly time appropriate 72 audio messages about the pregnancy, childbirth and childcare. So it is a mobile phone. You will take the 72 audio messages about the pregnancy. Next is the Raktakosh, and this Raktakosh is as a blood bank, integrated blood bank, and that will provide the real time management for the single window network for the blood bank. Okay, other schemes are also there in the health Ministry of Health and the Family Welfare, and these schemes are quite, other schemes are also there. So first scheme is National Program for Control the Blindness and Visual Impairment. It is for the blindness and visual impairment. So 1976 there was a 100% centrally sponsored. It is also the sponsored scheme. Okay, and 60 is to 40 is the ratio of this scheme. Okay, and reduce the prevalence of the blindness by the 0.3% by 2020, and also WHO is also working with this. Next is Project Sunrise, and this project is for the AIDS preventable special program for Northeast. So Northeast में क्या है कि AIDS is prevalent. So to reduce this prevalence of the AIDS in the Northeast, 90% drugs of the AIDS addict will be provided from the central government. So treatment 90% will be provided with the central government, and AIDS control organization like NACO is also working for the AIDS control. National AIDS Control Program. This is a new initiative like care and support and zero infection, zero stigma and zero death. So that is the response to the epidemic. Now next is Mission Sampark. Next is Mission Sampark. What do you know about the Mission Sampark? So this is a community based testing Okay, there will be a company based testing for the antiretroviral therapy, fast tracking identification about the HIV positive candidate. So this is the early warning system, community based testing, and antiretroviral therapy also. So there is a 90 90 and 90 treatment will be there for the AIDS related patients. Okay, 90% people living in the AIDS 2020 तक इसको reduce करना है. 90% people will be diagnosed, 90% people receiving antiretroviral therapy against the AIDS. So this is the 90-90-90 strategy against the AIDS. And project Sampark, mission Sampark, which is also to reduce the AIDS kind of disease, and to improve the awareness against the AIDS. Okay, now next one is Amrit. So Amrit is affordable medicine and reliable implant treatment, and this is about tie up with the government and Life Care Limited. So Amrit chain is pharmacy across the country bringing specialist care and knowledge. This is the Amrit. So it is for the drugs of the cancer and cardiovascular disease. So cancer and vascular disease are there, so we need to provide them disease medicines. For that we launched the Amrit chain. And now next is Pradhan Mantri Swasthya Suraksha Yojana, PM Swasthya Suraksha Yojana. So this is for the imbalance of the affordable healthcare. We need to provide the affordable healthcare. That's why we launched the Pradhan Mantri Swasthya Suraksha Yojana. And the next scheme is National Health Profile. So National Health Profile, and this profile in 2018 created database for the health information in the India, and Central Bureau of Health Intelligence is working with the National Health Profile. Next is National Health Repository. National Health Repository. Okay, so this repository is working to standardize authentic and updated geospatial data, and this is conceptualized with the ISRO project. So National Health Resource Repository is working with the ISRO, and it is in the collection of the statistics that was in 2008. Hospital, doctor, clinic and diagnostics is also available there. Next is Nikshay Poshan Yojana. This Nikshay Poshan Yojana is under the Ministry of Health and Family Welfare, incentive and nutritional support to the TB patients. For the TB patients, and